I'm Dr. Paola Sandroni. I am the director of the Autonomic lab here at Mayo Clinic, and I'm a professor of neurology. Autonomic test, it's a series of tests. It's not just one test. It's a panel, and the patient undergoes this test to assess the function or dysfunction of their autonomic nervous system, which is a system that controls the bodily function which are not under conscious control. Not every single domain is tested here. Other areas are tested, for instance, in gastroenterology or in urology. But we focus mainly on the more neurologic component of it. We have 3 autonomic labs, and then we have 2 thermoregulatory sweat labs, all located in the Gonda 8. The patients usually are sent to us to, first of all, determine if there is an autonomic problem. Some symptoms can mimic an autonomic problem, but may be due to some other ailments. And if the patient has an autonomic problem, we want to ascertain as much as possible the extent of it, the severity. The tests are non-invasive, so that will allow us also to follow patient over time, so we can observe our therapeutic intervention, for instance. Or in conditions that are progressive, or at least that evolve, we can follow the patient serially to see how things are going. A lot of medication, including over-the-counters, may impact the test results. So we ask the patient to check with the provider which medication should be discontinued if safe to do so. Also, we like the patient to be well acclimatized, particularly in days that are either very hot or very cold outside. We like them to be acclimatized indoor at least half hour. We like them to be well hydrated. We like them to refrain from large meals, smoking, coffee drinking for a number of hours before the test. And there are a couple of other minor preparation details, such as we don't want them to have any compressive garments and so forth, which are detailed in the brochure that we give the patient. As we go along, the technicians explain the patient what's going to happen. Some of these tests are actually fun. They're breathing exercise, blowing exercise, and other times the patient is just sitting quietly and just we do everything. The autonomic testing proper component lasts about 1 hour. And the testing that we do in the autonomic lab are testing pseudomotor function, adrenergic function, and cardiovagal function. In order to do that, we have 4 tests. The first one is called the Q-sweat. It's a test of sweating, as the name implies. And it's minimally painful, just due to the application of a small current to induce sweating. Following that, we have 2 breathing tests. One is a very easy fixed breathing rate test, and the second one is with a more forceful expiratory effort. And the 4th test is the tilt table, during which the patient who has been laying on the table is tilted passively, and during that time we record blood pressure and heart rate, and we document any changes. Other sweat test that we offer is in a separate lab, and it's an unstimulated sweat, but really mimics normal sweating, with the patient being placed in a hot environment after being dusted with a powder that changes color when it's wet and thus works as an indicator of the area of sweating. We reach a target of changing core temperature of at least 1 degree Celsius. We monitor skin and core temperature throughout the test. Sometimes the patient express concerns for the thermoregulatory sweat test. Particularly people that don't like the heat, they voice some concern about it. And we usually tell them it's like a hot day at the beach. We tell them to bring their music if they want to. The test results are read by the physician who is covering the lab for the day. There are 5 of us that rotate through. We monitor the test. We are there if there is any question or any problem that arise during the test execution, and we read the results. And as much as possible, we try to provide information to the referring physician what may be the most likely cause for this. The lab has been running for 25 years. We are the oldest lab, unquestionably the most experienced lab. Here, some of the tests have been developed. So I think we can definitely say we have the largest volume, the largest experience than anyone else.